Today we're going to be talking to this guy. His name is Dr. Joseph Allen. Dr. Allen has a YouTube channel known as Dr. Eye Health, and today we're going to be talking with him about that YouTube channel as well as dry eye protocols for mild to severe cases. Dr. Allen?
I want to talk to you.
Not now, later.
No, now.
Hello everyone and welcome to OCuTALK. Today we're going to be talking with Dr. Joseph Allen of Dr. Eye Health. Dr. Allen, thank you for being with us.
Hey, thank you so much, Thomas. Yeah, this is really great to be here.
Very good. Well, Dr. Allen, for our viewers who may not be familiar with your channel or who you are, could you take a moment and describe yourself for us?
Sure. Again, Dr. Joseph Allen. I'm a practicing board-certified optometrist. I practice here in the state of Minnesota, and I am also the host of the Dr. Eye Health show on YouTube, which helps people learn about the eyes, vision, and finding the best vision products. I graduated from the Rosenberg School of Optometry in San Antonio, Texas in 2015, did my residency in primary care and ocular disease at the Minneapolis VA Medical Center, and am now a fellow of the American Academy of Optometry since 2018. So I love optometry, I love eye care, and it's kind of my attempt to help as many people as I can, hence starting a YouTube channel all about eye care. So.
Very good. Well, and certainly we've had a chance to take a look at your videos, and it seems like one of the subjects that a lot of doctors are talking about nowadays, and certainly a subject that's very near and dear to our hearts, is dry eye. And I thought it might be interesting to have a discussion about how doctors are treating dry eye in their practice. So, Dr. Allen, if you could take a moment and walk us through what treatment protocols you would have for, say, a mild case, a moderate case, or a severe case of dry eye.
Well, that's an amazing question, Thomas. Yes, dry eyes is not only a huge passion of my own, but is a really big focus in optometry and eye care in general right now, because we're seeing so many people with these symptoms. You know, largely in the past, it was kind of like, yeah, you're going to get dry eye symptoms. Here's some eye drops, and hopefully it'll get better. Well, that never really worked. And so now we're spending a lot more time trying to fully understand the cause of the disease, the many different aspects that go into it, and then of course the different stages in identifying, hey, what is a mild case of dry eye disease, and what's a moderate, what's a severe, and then applying our different treatment modalities. Almost everybody in their lifetime will experience some form of dryness, whether that be just grittiness, irritation. They'll feel like there's even a foreign body sensation on the eye, sometimes just stinging or fluctuating vision. I think a lot of people fail to recognize how crucial the tear film is on the eye to their vision. And so a lot of times people don't connect that their vision fluctuating really is a sign or a symptom of their dry eye disease. So if somebody's having just their typical occasional burning sensation or occasional dryness, maybe reflex tearing, their eyes are suddenly watery all of a sudden, that could just be a mild case of dry eye. In those cases, artificial tears in terms of using an eye drop to kind of replenish the tears, that's great. And there's other sort of kind of at-home ways to help heal or make the eyes feel more comfortable. And that could be something like using a hot compress. Those do great at making people feel better. But when you start getting into more of the moderate signs and symptoms, when this is a chronic issue, when you're experiencing this every day and it's disturbing your qualities of life, you're having trouble working, trouble driving, enjoying your time with your friends and family, and then it's becoming more moderate to severe. And that's when eye doctors like myself will start to recognize a lot of more severe signs on the surface of the eye. We'll actually start to see defects, little bumps on the surface of the eye that we call superficial punctate keratitis, or SPK. In those more moderate and going on to really severe cases, that's when just using supplemental eye drops usually isn't enough. Instead, we have to consider medicated eye drops, certain procedures in the office, as well as other forms of maybe humidifier, protecting eye goggles, and other lifestyle changing factors. And it's usually not just one of these treatments, it's a combination of multiple strategies, because If you ever will read maybe like the DEWS 2 report, that's the dry eye workshop study reports. These are some of the best eye doctors and dry eye specialists all come together to study dry eye and come up with proper procedures and treatments. They've identified that a dry eye is not just the lack of tears on the eye, it's multifactorial, and there's many aspects to not only our health, but our lifestyles that affect it.
Well, Dr. Allen, speaking of dry eye, we're talking about severe cases and moderate cases. When should I be concerned as a patient to when I've crossed that barrier from being a mild case into a moderate case?
So I think for anybody, if you're just having, occasional, like once a month, you're feeling, yeah, my eye feels a little irritated, that could be just a regular symptom of dryness. Maybe wind hit your eye really hard. But for somebody who's experiencing this every week, certainly every day, that's going to be more of a concern. That could be the front tail symptom. And oftentimes we'll even see evidence of dryness on the eye before patients even realize that they have a problem. Because our eyes do adapt. Kind of like if you're used to wearing a contact lens, the first time you put it on, you can kind of feel it, but over time you adapt to it and you get used to it on the eye. And so I feel a lot of our dry eye sufferers, they don't even realize that they have the problem because they've already adapted to it. So I think if you are certainly getting a yearly eye checkup, perfect, because then your doctor hopefully will be able to observe and catch things early. But if you are having symptoms and you haven't seen an eye doctor lately, I think it is still wise to at least get it checked out, make sure it is dry eye and not something else. And then certainly consider getting some additional treatment, more so than just picking up a random eyedropper from anything that you find at the pharmacy.
It's interesting too. Some of what you've been talking about are some negative effects that can come from prolonged dry eye. Can you describe some of those to us?
Well, of course, the biggest issues that we see for like long-term problems from dry eyes is that the surface of the eye is, again, so critical for having good vision. And if you have dryness on the eye that's long-standing, it's no longer just having the occasional symptom of dryness. The integrity of the cornea and the ocular surface becomes jeopardized. And you can have dry spots that appear. Again, I mentioned that before, called SPK. And those can eventually lead to scarring. They can change the surface of the eye so it becomes irregular. And then you can have inflammatory cascades on the surface of the eye that can damage the eyelids. And ultimately, I have patients who have trouble really seeing, and they're just not comfortable because there's been pretty much permanent damage to the surface of their eye from their extreme dryness.
And I think that's a very interesting topic to talk about because I think a lot of people think that this is just a minor inconvenience. And in a lot of cases, it certainly is something that, as you said, can be self-medicated. But I think it's important for people to remember that there are issues that can come from this. And, any prolonged symptom that you have probably shouldn't be ignored.
Absolutely. I 100% agree.
Well, Dr. Allen, one of the things that you mentioned was people that, let's say I had a mild case and I were going to the pharmacy to try to self-medicate or get some OTC artificial eye drops or lid scrubs or other things like that. If I'm a patient in a pharmacy, what things should I look out for when looking for a product to help self-medicate?
So this is a big issue that not just myself, but every eye care professional will face. And I've gone to the pharmacy myself and looked at the shelf. There's like 300 some different eye drops, and they're all in similar boxes. Like all the companies, I swear, are competing, trying to like mimic the other company and trying to get people's attention. And if you don't know anything about these drops, how are you supposed to have knowledge of what you should be grabbing? Unfortunately, some of the more famous names I find people will come in, they'll know that, oh, this drop is this one I've seen on TV, so it must be good. And chances are, most of the time, they're getting a drop that also contains not only preservatives that can cause damage to the eye if they're using it too much, but they'll also contain other medicated additives to constrict blood vessels. And they'll see that as like, get the red out and trying to get the red away. Those types of eye drops, although it does make your eyes look white momentarily, the medications used in those drops, they are old medications. and they have a certain component to them called tachyphylaxis, which means that they kind of wear off. So you can use it and it works one day, but then it wears off, and then you use it again, and now your body doesn't respond to it as well as it did the first time. So it doesn't last as long, and you use it again, and then you use it again. And it can have this rebound effect where their eyes ended up becoming more red and more irritated. And that's not good for the patient. And for us, it masks the real cause of the problem. So it makes our job more difficult. So overall, that's a frustration that, again, not just me, but all the eye doctors have. So when it comes to looking at these different drops on the shelf, I think one, if your doctor has recommended a drop for you based on the type of dry eye you have, try to continue to use those drops if they feel good. If you have a problem with those drops, call your eye doctor, revisit them, have a discussion with them what they think would be best for you, and certainly try to go those routes.
You know, I'm glad we're having this conversation, and I'm certainly glad that you have your YouTube channel, because these are a lot of topics that I think people are aware of dry eye and different things of that nature, and maybe people aren't aware of the different treatment options, or even just the different the different disorders that can cause this in the first place. So I think having a channel like Dr. Eye Health is very valuable. Maybe you could spend a moment here just describing the type of content that people can find on your channel.
Thanks, Thomas. Yeah, so I've been working on this channel for 2 years now, and I'm trying to cover as many topics in eye care as I can, because when I started the channel, part of it was that I did my own research online. What other videos are there? What education is there about eye care? And there was just very little. And so I'm like, okay, there's a lot of need here. So I certainly do have a lot of content on dry eyes, being that's a kind of a passion of my own. So you'll find videos going over different causes of dry eyes, the different types of diseases that could potentially cause dry eyes, as well as my recommendations for eye drops, different eyelid cleaning solutions, trying to keep the eyes healthy, because it's not just my mission to help people see better and have healthy eyes, but it's not just today, but it's also helping people have good health tomorrow. So it covers a lot of those topics. I also have videos on contact lenses, glasses, retinal diseases, kind of covering all these different aspects, because healthcare is pretty dynamic. And thankfully, some other eye health professionals are starting to kind of get into the space, which makes me happy, because I don't feel like I can do it all on my own. But yeah, so if you or any of your viewers find this and they'd like to learn more about the eyes, then definitely check out my channel, and hopefully you find it helpful.
Well, we will certainly link to that video in the description, so you guys can check out Dr. Allen's page. You know, Dr. Allen, one of the things that you just touched on a second ago, you mentioned the word eyelid hygiene, and certainly that's something we're very familiar with, but could you go into that a little bit about the importance of eyelid hygiene to overall eye health?
Yeah, one of the biggest things that I've noticed is that most people neglect to wash their eyelids. I think early on in life, hopefully you learned it's important to bathe and wash your face. I know in junior high, I learned that because, you don't want acne, but I always avoided washing my eyes because I didn't want soap in my eyes. It burns your eyes. But the reality is our eyelashes, they produce oils, and bacteria will eat those oils, and then they release toxins. And believe me, your eyes are just a warm, watery place for bacteria to live. And so that leads to irritation, inflammation. We call that blepharitis, when you have inflammation on your eyelids. And that can actually cause problems with dry eye disease, cause pink eye infections. So cleaning the eyelids and keeping them healthy is a really important aspect of eye care. And in fact, as we get older, problems only get worse. So I often have conversations with the parents of teenagers and people coming in, and certainly anybody who's a contact lens wearer. They're touching the eyes more. They need to keep really good care of their eyelids.
Thank you so much for joining us today. And definitely, as I said, we will link Dr. Allen's YouTube channel in the description. But again, Dr. Allen, thank you for joining us today.
Hey, thank you so much, Thomas.